US health officials are encouraging people to stay calm and issuing advice on how to minimize the risk of infection. But as RT's Caleb Maupin explains, many Americans are finding it hard to follow some of those recommendations.
The United States, just like all other countries, is calling on people to take precautions. However, for some that may not be an option. This is what the Center for Disease Control is saying.
If you yourself are infected, stay out of work. If you have a cough, it could be a pneumonia, you should see a physician.
It's good advice, but it comes at a hefty price that some Americans cannot afford. Many Americans are more afraid of paying up than getting sick. One study shows that 40% of Americans didn't get a medical test or treatment within a single year, and that 44% didn't go to the docs when they were sick or injured. The case of Osmel Martinez Azcu is a testament to this. He did the responsible thing. After going to China, he decided to go and get a test. But with his limited insurance, he ended up with a giant bill.
How can they expect normal citizens to contribute to eliminating the potential risk of person-to-person spread if hospitals are waiting to charge us $3,270 for a simple blood test and a nasal swab?
Now later, his bill got reduced to roughly $1,400, but that's still a pretty sizable sum. If you don't have insurance, plan on dishing out about $1,200. So we decided to ask people here whether they would be able to shell out during an epidemic. For those who do not have health insurance, it costs roughly $1,300 to be tested for the coronavirus. How do you feel about that?
That's a big piece of change. Government should chip in.
It's craziness. I mean, we have to change that. It should be free, especially in a time like this.
It's obscene, $1,300.
This is just another indicator of how to control healthcare costs. Why does it cost that much money? I mean, I don't know, is that like how's that price set?
Now, this is advice that hopefully everyone can afford.
We always say it, it sounds simplistic, but it's true. Washing of hands. The most important thing for a mask would be if someone is infected to prevent them from infecting others.
Now, that's also very good advice. Americans are taking it, and at this point, drugstores are limiting the amount of sanitizers and wipes individuals can buy. Now, those who are stocking the virtual shelves at Amazon, Walmart, and eBay are testing to see how much the market will bear. This is capitalism's classical function called supply and demand. But there's outrage. People feel like this is a greedy gouge at a moment where we're facing a very serious public health crisis. The governor of California has joined the outrage against Amazon. But even that online retail giant says it's fighting against third-party sellers and that they will reemerge.
We have a health system that is completely wrongly constructed to deal with a pandemic that affects people of every wealth status. Everybody gets health care when they need it. They don't have to have the money to pay for it. And unless we have that in the United States, we're the only developed country in the world, as far as I know, that does not have that. And because we don't have it, we're now facing a major crisis because of this pandemic.